Question 1. A laboring client at 39 weeks gestation is receiving an oxytocin infusion for augmentation of labor. The fetal heart rate tracing suddenly shows recurrent late decelerations with minimal variability. Contractions are occurring every 90 seconds and lasting 95 seconds. Which action should the nurse take first? Answer: B. Reposition the client to the left lateral position. Rationale: recurrent late decelerations with tachysystole indicate utero-placental insufficiency and fetal hypoxia. The priority intervention is improving placental perfusion by repositioning the client laterally before additional interventions. Question 2. A nurse is reviewing a fetal monitor strip of a client in active labor. The tracing reveals absent variability and repetitive variable decelerations to 70 beats per minute, lasting 60 seconds. A. Baseline fetal heart rate of 135 beats per minute. B. Presence of accelerations earlier in labor. C. Absent variability with recurrent decelerations. D. Contractions occurring every 4 minutes. Answer: C. Absent variability with recurrent decelerations. Rationale: absent variability combined with recurrent decelerations strongly suggests fetal hypoxemia and acidemia, requiring immediate evaluation and intervention. Question 3. A pregnant client at 40 weeks is undergoing induction with oxytocin. The fetal heart tracing demonstrates prolonged deceleration lasting 3 minutes after spontaneous rupture of membranes. The nurse notes the umbilical cord protruding from the vagina. Which action is the priority? A. Place the client in high Fowler's position. B. Push the presenting part upward with a sterile gloved hand. C. Obtain a fetal scalp electrode. D. Administer methylergonavine immediately. Answer: B. Push the presenting part upward with a sterile gloved hand. Rationale: umbilical cord prolapse is an obstetric emergency. Relieving pressure on the cord to restore fetal oxygenation is the immediate priority. Question 4. A client in labor develops recurrent variable decelerations. Which intervention would the nurse anticipate first? A. Amnio infusion. B. Magnesium sulfate administration. C. Immediate vacuum-assisted delivery. D. Administration of terbutaline. Answer: A. Amnio infusion. Rationale: recurrent variable decelerations are commonly caused by cord compression. Amnio infusion may reduce compression by increasing intrauterine fluid volume. Question 5. A nurse is caring for a laboring client whose fetal monitor tracing reveals a sinusoidal pattern. Which condition is most associated with this finding? A. Fetal sleep cycle. B. Severe fetal anemia. C. Maternal hypoglycemia. D. Maternal hypertension. Answer: B. Severe fetal anemia. Rationale: a true sinusoidal fetal heart rate pattern is associated with severe fetal anemia and significant fetal compromise. Question 6. A client at 41 weeks gestation reports decreased fetal movement. During monitoring, the nurse notes fetal tachycardia with minimal variability. Maternal temperature is 39 degrees Celsius, 102.2 Fahrenheit. Which complication should the nurse suspect? A. Placenta previa. B. chorioamnionitis. C. Umbilical cord prolapse. D. Mild fetal sleep cycle. Answer: B. Chorioamnionitis. Rationale: maternal fever with fetal tachycardia strongly suggests intraamniotic infection, which increases fetal distress risk. Question 7. A nurse notes recurrent late decelerations in a client receiving epidural anesthesia. Maternal blood pressure is 78/40 millimeters of mercury. Which action is the nurse's priority? A. Apply internal fetal monitoring. B. Increase the oxytocin infusion. C. Administer IV fluid bolus. D. Encourage pushing efforts. Answer: C. Administer IV fluid bolus. Rationale: epidural anesthesia may cause maternal hypotension, reducing placental perfusion and causing late decelerations. Correcting hypotension is the priority. Question 8. A laboring client's fetal monitor tracing demonstrates variable decelerations that become deeper and longer over time. Which interpretation is most accurate? A. Benign fetal sleep pattern. B. Progressive fetal compromise from cord compression. C. Normal response to contractions. D. Maternal hyperglycemia effect. Answer: B. Progressive fetal compromise from cord compression. Rationale: worsening variable decelerations indicate increasing umbilical cord compression and deteriorating fetal oxygenation. Question 9. A client in labor experiences uterine tachysystole after oxytocin administration. The fetal heart tracing shows recurrent late decelerations. Which prescription should the nurse anticipate? A. Continue oxytocin at current rate. B. Increase maternal ambulation. C. Discontinue oxytocin infusion. D. Begin pushing immediately. Answer: C. Discontinue oxytocin infusion. Rationale: oxytocin-induced tachysystole decreases fetal oxygenation. Stopping oxytocin is necessary to reduce uterine activity and improve placental blood flow. Question 10. A nurse is evaluating a fetal heart tracing with moderate variability and accelerations. Occasional early decelerations are present. Which interpretation should the nurse make? A. Fetal hypoxia is occurring. B. The fetus is acidotic. C. The tracing is reassuring. D. Immediate cesarean birth is indicated. Answer: C. The tracing is reassuring. Rationale: moderate variability and accelerations indicate adequate fetal oxygenation. Early decelerations are usually benign and caused by fetal head compression. Question 11. A laboring client at 38 weeks gestation suddenly develops recurrent prolonged decelerations after placement of an epidural block. The maternal blood pressure drops from 124/78 mmHg to 82/46 mmHg. Which action should the nurse implement first? A. Increase oxytocin infusion. B. Place the client in a supine position. C. Reposition the client laterally and increase IV fluids. D. Prepare for immediate forceps delivery. Answer: C. Reposition the client laterally and increase IV fluids. Rationale: maternal hypotension after epidural anesthesia reduces uteroplacental perfusion, leading to fetal distress. Lateral positioning and IV fluid bolus improves circulation and fetal oxygenation. Question 12. A client in labor has a fetal heart tracing showing recurrent late decelerations with absent variability despite intrauterine resuscitative measures. Which action should the nurse anticipate next? A. Continue observation for 1 hour. B. Immediate operative delivery. C. Encourage maternal pushing. D. Ambulate the client in the hallway. Answer: B. Immediate operative delivery. Rationale: persistent late decelerations with absent variability indicates severe fetal compromise and possible acidemia requiring rapid delivery. Question 13. During labor, the fetal monitor reveals abrupt decreases in fetal heart rate below baseline that vary in timing and shape with contractions. Which nursing interpretation is correct? A. Early decelerations from head compression. B. late decelerations from placental insufficiency. C. Variable decelerations from umbilical cord compression. D. Sinusoidal pattern from fetal anemia. Answer: variable decelerations from umbilical cord compression. Rationale: variable decelerations are abrupt decreases in fetal heart rate caused primarily by cord compression. Question 14. A nurse is caring for a client with preeclampsia receiving magnesium sulfate during labor. The fetal tracing now demonstrates minimal variability. Which interpretation is most appropriate? A. Immediate fetal demise is occurring. B. Magnesium sulfate may decrease fetal heart variability. C. Variable decelerations are expected. D. The fetus is experiencing cord prolapse. Answer: B. Magnesium sulfate may decrease fetal heart variability. Rationale: magnesium sulfate can cause decreased fetal heart rate variability due to its central nervous system depressant effects. Question 15. A client in labor demonstrates recurrent late decelerations. Which maternal condition places the fetus at greatest risk for this pattern? A. Maternal hypotension. B. Polyhydramnios. C. Maternal anxiety. D. Fetal hiccups. Answer: A. Maternal hypotension. Rationale: late decelerations are caused by utero-placental insufficiency, commonly resulting from maternal hypotension. Question 16. A laboring client's fetal monitor tracing shows bradycardia at 90 beats per minute lasting longer than 10 minutes. Which interpretation should the nurse make? Answer: B. Prolonged fetal bradycardia requiring urgent evaluation. Rationale: persistent fetal bradycardia may indicate severe fetal hypoxia and requires immediate assessment and intervention. Question 17. A client at 39 weeks gestation experiences sudden severe abdominal pain, vaginal bleeding, and fetal bradycardia during labor. Which complication should the nurse suspect? A. Placenta previa. B. Uterine rupture. C. Mild cord compression. D. Fetal sleep cycle. Answer: B. Uterine rupture. Rationale: sudden abdominal pain, bleeding, and fetal bradycardia are classic findings of uterine rupture, an obstetric emergency. Question 18. A nurse notes recurrent variable decelerations with a slow return to baseline and loss of variability during labor. Which finding is most concerning? A. Accelerations after fetal movement. B. Moderate baseline variability. C. Progressive worsening variable decelerations. D. Early decelerations during contractions. Answer: C. Progressive worsening variable decelerations. Rationale: progressive worsening variable decelerations with decreased variability indicate deteriorating fetal oxygenation and increasing compromise. Question 19. A laboring client has a Category 3 fetal heart tracing. Which nursing action has the highest priority? A. Continue routine labor monitoring. B. Begin intrauterine resuscitation measures. C. Encourage oral fluid intake. D. Delay intervention until the provider arrives. Answer: B. Begin intrauterine resuscitation measures. Rationale: Category 3 tracings are abnormal and indicate possible fetal hypoxia. Immediate intrauterine resuscitation is required. Question 20. A client receiving oxytocin has contractions every 1 minute, lasting 100 seconds. The fetal heart tracing shows recurrent late decelerations. Which action should the nurse take first? A. Administer additional oxytocin, B. Stop the oxytocin infusion. C. Encourage maternal ambulation. D. Place the client in lithotomy position. Answer: B. Stop the oxytocin infusion. Rationale: uterine tachysystole from oxytocin decreases placental perfusion and contributes to fetal distress. Discontinuing oxytocin is the priority intervention. Question 21. A nurse is caring for a laboring client whose fetal monitor tracing shows recurrent late decelerations despite oxygen administration and maternal repositioning. Which additional intervention should the nurse anticipate? A. Increase oxytocin infusion. B. Administer a tocolytic medication. C. Encourage frequent pushing. D. Place the client flat on her back. Answer: B. Administer a tocolytic medication. Rationale: if uterine tachysystole contributes to fetal distress, a tocolytic such as terbutaline may be prescribed to decrease uterine activity and improve fetal oxygenation. Question 22. A fetal heart tracing demonstrates a baseline of 170 beats per minute with moderate variability. Which maternal condition is most likely associated with this finding? A. Maternal hypothermia. B. Maternal fever. C. Maternal bradycardia. D. Maternal hypotension. Answer: B. Maternal fever. Rationale: fetal tachycardia is commonly associated with maternal fever or infection and may indicate developing fetal compromise. Question 23. A laboring client suddenly reports feeling something coming out of the vagina after rupture of membranes. The fetal heart rate drops to 70 beats per minute. Which nursing action is priority? A. Apply a fetal scalp electrode. B. Prepare for amnio infusion. C. Relieve pressure on the prolapsed cord. D. Encourage the client to push. Answer: C. Relieve pressure on the prolapsed cord. Rationale: cord prolapse causes severe fetal hypoxia from cord compression. Immediate manual relief of pressure on the cord is the priority. Question 24. A nurse reviews a fetal monitor strip showing minimal variability without decelerations in a client who recently received IV butorphanol for labor pain. Which interpretation is most accurate? A. Severe fetal acidemia is present. B. Opioid medication may reduce variability temporarily. C. Immediate cesarean birth is required. D. Cord prolapse is occurring. Answer: B. Opioid medication may reduce variability temporarily. Rationale: opioid analgesics can transiently decrease fetal heart rate variability because of fetal central nervous system depression. Question 25. A client at 40 weeks gestation is in active labor. The fetal monitor tracing reveals repetitive late decelerations and absent accelerations. Which fetal physiologic process is occurring? Answer: B. Reduced uteroplacental oxygen exchange. Rationale: late decelerations reflect uteroplacental insufficiency, causing impaired fetal oxygen exchange. Question 26. A laboring client's fetal tracing reveals recurrent deep variable decelerations. After repositioning and oxygen administration, the decelerations persist. Which intervention should the nurse anticipate next? A. Amnio infusion. B. Administration of oxytocin. C. Maternal ambulation. D. Fundal pressure during contractions. Answer: A. Amnio infusion. Rationale: persistent deep variable decelerations are often managed with amnio infusion to reduce umbilical cord compression. Question 27. A nurse identifies a fetal heart tracing with absent variability and recurrent bradycardia. Which fetal condition is most concerning? A. Fetal sleep cycle. B. Severe fetal hypoxia. C. Maternal anxiety. D. Benign cord compression. Rationale. Absent variability with recurrent bradycardia strongly suggests significant fetal oxygen deprivation and acidemia. Question 28. A client receiving oxytocin for labor augmentation develops contractions every 90 seconds, lasting 110 seconds. The fetal tracing shows late decelerations. Which nursing intervention is most appropriate? A. Increase oxytocin to strengthen contractions. B. Stop oxytocin and reposition the client. C. Encourage immediate pushing. D. Maintain current interventions without changes. Answer. B. Stop oxytocin and reposition the client. Rationale. Oxytocin-induced tachysystole can compromise fetal oxygenation. Discontinuing oxytocin and repositioning improve placental blood flow. Question 29. A nurse observes a gradual decrease in fetal heart rate beginning after the contraction starts and returning to baseline after the contraction ends. Which type of deceleration is occurring? A. Variable deceleration. B. Prolonged deceleration. C. Early deceleration. D. Late deceleration. Answer. D. Late deceleration. Rationale. Late decelerations begin after the contraction starts and recover after the contraction ends, indicating uteroplacental insufficiency. Question 30. A client in labor has a Category 2 fetal heart tracing with minimal variability and intermittent variable decelerations. Which action should the nurse take first? A. Continue close surveillance and intrauterine resuscitative measures. B. Prepare immediately for cesarean birth. C. Discontinue all monitoring. D. Encourage ambulation without reassessment. Answer. A. Continue close surveillance and intrauterine resuscitative measures. Rationale. Category 2 tracings are indeterminate and require ongoing assessment and interventions to improve fetal oxygenation before operative delivery is considered. Question 31. A laboring client experiences a sudden prolonged fetal heart rate deceleration to 65 beats per minute immediately after a vaginal examination. Which complication should the nurse suspect first? A. Placental abruption. B. Umbilical cord prolapse. C. Maternal hypoglycemia. D. Fetal sleep cycle. Answer. B. Umbilical cord prolapse. Rationale. Sudden prolonged bradycardia after rupture of membranes or vaginal examination strongly suggests cord prolapse until proven otherwise. Question 32. A nurse is assessing a fetal monitor tracing with moderate variability, recurrent early decelerations, and accelerations present. Which nursing interpretation is most accurate? Severe fetal hypoxia is occurring. B. Fetal status is reassuring. C. Immediate operative birth is required. Answer. B. Fetal status is reassuring. Rationale. Moderate variability and accelerations indicate adequate fetal oxygenation. Early decelerations are usually benign and caused by head compression. Question 33. A client at 37 weeks gestation has abrupt onset of intense uterine pain, dark vaginal bleeding, and a rigid abdomen. The fetal monitor reveals recurrent late decelerations followed by bradycardia. Which complication should the nurse suspect? A. Placenta previa. B. Uterine inversion. C. Placental abruption. D. Amniotic fluid embolism. Answer. C. Placental abruption. Rationale. Painful bleeding with uterine rigidity and fetal distress is classic for placental abruption, which severely compromises fetal oxygenation. Question 34. A laboring client receiving oxytocin develops uterine tachysystole and recurrent variable decelerations. Which prescription should the nurse anticipate? A. Increase oxytocin dosage. B. Administer terbutaline. C. Encourage pushing during contractions. D. Maintain the client in supine position. Answer. B. Administer terbutaline. Rationale. Terbutaline may be prescribed to reduce excessive uterine contractions and improve fetal oxygenation. Question 35. A nurse notes absent fetal heart rate variability with recurrent late decelerations. Which additional finding would most strongly support worsening fetal acidemia? A. Presence of accelerations. B. Persistent fetal tachycardia. C. Baseline variability becoming moderate. D. Early decelerations with contractions. Answer. B. Persistent fetal tachycardia. Rationale. Persistent tachycardia with absent variability and recurrent late decelerations may indicate worsening fetal hypoxia and acidemia. Question 36. A client in labor has recurrent variable decelerations that resolve with maternal repositioning. Which interpretation should the nurse make? Cord compression was temporarily relieved. B. Placental abruption is worsening. C. Severe fetal anemia is present. D. Immediate cesarean birth is mandatory. Answer. A. Cord compression was temporarily relieved. Rationale. Variable decelerations are usually related to cord compression and often improve with maternal repositioning. Question 37. A nurse identifies a sinusoidal fetal heart rate pattern lasting longer than 20 minutes. Which action is most appropriate? A. Continue routine monitoring only. B. Notify the provider immediately. C. Encourage maternal ambulation. D. Increase oxytocin infusion. Answer. B. Notify the provider immediately. Rationale. A true sinusoidal pattern is associated with severe fetal compromise, such as fetal anemia, and requires urgent evaluation. Question 38. A laboring client develops maternal hypotension after epidural placement. The fetal monitor shows recurrent late decelerations. Which intervention is contraindicated? A. Lateral maternal positioning. B. IV fluid bolus administration. C. Supine positioning. D. Oxygen administration. Answer. C. Supine positioning. Rationale. Supine positioning worsens vena cava compression and decreases uteroplacental perfusion, further compromising fetal oxygenation. Question 39. A nurse is caring for a laboring client with meconium-stained amniotic fluid and recurrent late decelerations. Which fetal complication is most concerning? Fetal macrosomia, meconium aspiration syndrome, neonatal hypoglycemia, polycythemia. Answer. B. Meconium aspiration syndrome. Rationale. Meconium-stained fluid with fetal distress increases the risk for meconium aspiration syndrome after birth. Question 40. A client's fetal heart tracing demonstrates recurrent prolonged decelerations despite oxygen administration, discontinuation of oxytocin, and maternal repositioning. Which action should the nurse anticipate next? Continue observation for another hour. B. Immediate operative delivery. C. Encourage oral hydration. D. Ambulate the client. Answer. B. Immediate operative delivery. Rationale: persistent prolonged decelerations, despite intrauterine resuscitation, indicate significant fetal compromise, requiring rapid delivery. Question 41. A laboring client's fetal heart tracing changes from moderate variability to absent variability with recurrent late decelerations. Which physiologic change is occurring in the fetus? A. Improved cerebral oxygenation. B. Progressive fetal hypoxemia. C. Normal fetal sleep cycle. D. Increased placental perfusion. Answer: B. Progressive fetal hypoxemia. Rationale: absent variability with recurrent late decelerations is highly concerning for worsening fetal oxygen deprivation and acidemia. Question 42. A nurse notes a fetal heart rate of 175 beats per minute with recurrent variable decelerations and maternal temperature of 38.9 degrees Celsius, 102 degrees Fahrenheit. Which intervention is priority? A. Administer prescribed antipyretics and IV fluids. B. Encourage maternal pushing. C. Place the client in Trendelenburg position. D. Increase oxytocin infusion rate. Answer A. Administer prescribed antipyretics and IV fluids. Rationale: maternal fever contributes to fetal tachycardia and fetal stress. Reducing maternal temperature and improving hydration are priority interventions. Question 43. A laboring client suddenly develops sharp abdominal pain, followed by cessation of contractions and fetal bradycardia. Which obstetric emergency should the nurse suspect? A. Placenta previa. B. Uterine rupture. C. Mild cord compression. D. Hyperemesis gravidarum. Answer: B. Uterine rupture. Rationale: sudden pain, loss of contractions, and fetal bradycardia are classic findings of uterine rupture, requiring immediate intervention. Question 44. A fetal monitor tracing reveals recurrent variable decelerations with shoulders before and after the deceleration. Which interpretation is most accurate? A. Severe fetal acidemia. B. Cord compression with compensatory response. C. Placental insufficiency. D. Fetal demise pattern. Answer B. Cord compression with compensatory response. Rationale: shoulders are brief accelerations occurring before and after variable decelerations and are associated with transient cord compression. Question 45. A nurse is caring for a client receiving oxytocin. The contractions are every 2 minutes, lasting 95 seconds, with recurrent late decelerations. Which nursing action is most appropriate? A. Continue oxytocin as prescribed. B. Reduce or discontinue oxytocin infusion. C. Encourage immediate bearing down efforts. D. Place the client in high Fowler's position. Answer: B. Reduce or discontinue oxytocin infusion. Rationale: excessive uterine activity decreases fetal oxygenation and contributes to late decelerations. Oxytocin should be reduced or stopped. Question 46. A client's fetal monitor tracing demonstrates minimal variability after administration of magnesium sulfate therapy. Which assessment finding would require immediate concern? A. Moderate variability returns after 20 minutes. B. Presence of fetal accelerations. C. Recurrent late decelerations accompany minimal variability. D. Baseline fetal heart rate of 135 beats minute. Answer: C. Recurrent late decelerations accompany minimal variability. Rationale: although magnesium sulfate can decrease variability, recurrent late decelerations indicate worsening uteroplacental insufficiency and fetal compromise. Question 47. A laboring client has a prolonged deceleration lasting 5 minutes. Which nursing action should the nurse implement first? A. Continue routine monitoring. B. Reposition the client and discontinue oxytocin if infusing. C. Encourage maternal ambulation. D. Delay intervention until another contraction occurs. Answer. B. Reposition the client and discontinue oxytocin if infusing. Rationale. Immediate intrauterine resuscitation is required during prolonged decelerations to improve fetal oxygenation. Question 48. A nurse observes recurrent late decelerations in a client with severe preeclampsia. Which pathophysiologic process is causing fetal distress? A. Umbilical cord compression. B. Reduced utero-placental blood flow. C. Fetal head compression. D. Maternal hyperglycemia. Answer. B. Reduced utero-placental blood flow. Rationale. Severe preeclampsia causes vasospasm and decreased placental perfusion, leading to uteroplacental insufficiency and late decelerations. Question 49. A client in labor has recurrent deep variable decelerations to 60 beats per minute, lasting 90 seconds. Which finding indicates worsening fetal compromise? A. Moderate baseline variability. B. Rapid return to baseline after contractions. C. Slow recovery and loss of variability. D. Presence of accelerations. Answer. C. Slow recovery and loss of variability. Rationale. Slow recovery from decelerations with decreasing variability suggests worsening fetal oxygenation and possible acidemia. Question 50. A laboring client's fetal heart tracing is categorized as Category 3, despite multiple intrauterine resuscitation measures. Which outcome is the priority goal of care? A. Prolong labor to achieve vaginal birth. B. Reduce maternal discomfort only. C. Expedite delivery to prevent fetal injury. D. Delay intervention until fetal movement decreases. Answer. C. Expedite delivery to prevent fetal injury. Rationale. Persistent Category 3 fetal heart tracings indicate abnormal fetal acid-base status and require rapid delivery to prevent permanent fetal injury or death. That wraps up the 50 Nclex most difficult fetal distress scenario set. In real exam conditions, fetal monitoring questions are rarely about memorization. They're about one thing: recognizing deterioration early and acting in the correct order of priority. Most wrong answers usually come from skipping that first stabilizing step: repositioning, stopping oxytocin, improving oxygenation, or relieving cord compression. If you want to push further, the next logical step would be mixed NGN case progression. Category 1, 2, 3, deterioration. Or SATA, fetal monitoring traps. Or OB, emergency rapid response drills, cord prolapse, abruption, uterine rupture. Just tell me what direction you want next.